always great to be back home. I'm having a healthcare town hall meeting today, this afternoon, over on the Galt. What the president says is going to happen is they're going to have a new bill, a reconciliation bill, which is going to be they call it a sidecar. It's going to run next to the main bill. So they're going to take the bill that passed the Senate in December and try to convince the House members to vote for it on the understanding that they'll fix all their problems in the reconciliation bill and then send it to the Senate and it'll get passed, which to me is a big leap of faith. If I were a House Democrat who had questions about this bill and the story I was supposed to believe was, okay, just pass this bill and then we'll fix it all and Harry Reid in the Senate will take care of it for you, I'd be a little concerned. But that's the plan. We haven't seen what the president's bill is or this reformed bill is. We had the president's outline from the Blair House meeting, which had some good stuff in it, but still, didn't talk about the underlying Senate bill, which in my mind is fundamentally flawed. It's flawed because it creates a whole new program out of it, $1 trillion or more, $500 million of cuts to Medicare, which, being a senator from Florida, I don't know how I can support any plan that cuts $500 billion from health care for seniors when that program is already set to be in financial trouble in 7 years from now. It then raises taxes for $500 million.
Actually, what did you say it cuts from Medicare?
$500 billion, $500 billion. Raises taxes by the same amount on medicine and on medical devices, which I think will end up, we'll all pay for that in the cost of our health care. I think it'll get passed along. And the most fundamental problem with the bill, and this is not me talking, it's the CBO talking and the chief actuary is from HHS, is that it does not lower the cost of health insurance, which is what we were supposed to be about when we did this bill. It's going to provide access to a lot of people, but for the 170 million or so people who have health insurance already, it is not going to lower their cost of health insurance. I think there's a lot of things we can do and should do, and if we work together in a step-by-step way, I think we could get a lot of stuff passed. What I had hoped for at that meeting with the president is he would have sat down and said, okay, let's not just make speeches, but let's get something done. I want to make sure, for example, that no one gets dropped for having a pre-existing condition. You want insurance companies to compete across state lines. Let's put those together in a bill and pass it. What's the next issue that I've got to have, you've got to have? I was hoping that there was going to be an attempt to make some things get passed. I've got this healthcare fraud prevention bill. I think you all know that South Florida is the healthcare fraud capital of the world. The one statistic that is most alarming to me is we have 7% of the AIDS population in Miami-Dade County, but we reimburse more than 80% of all AIDS medications in the country to Miami-Dade County. It is rampant with fraud. I've got a proposal that goes off of the credit card business's proposal, and you've all had this experience where you use your credit card someplace and you get a phone call or an email from your credit card company saying, is that really you? Did you really mean to do that? It's called predictive modeling, and they put that in, and they build a model around your particular experiences. They build a model based upon trends they know in fraud, and unless you verify, they don't pay. Well, why can't we do that for healthcare? And I talked to the worldwide head of fraud prevention for MasterCard and said, can we do this for healthcare? And he said, sure you can. We lose $60 billion to $100 billion a year in waste, fraud, and abuse in Medicare alone. So I have a plan to take this same predictive modeling and put it in the healthcare arena. And one group in Washington who's evaluated says it'll save $20 billion a year. That shouldn't be a partisan issue. I've got bipartisan support for it. I tried to bring it up and amend it to the health care bill last December. They wouldn't let me. Now, the president in his outline has something like it, so maybe he's going to put it in his bill. But to me, we shouldn't have to have these big, mammoth, comprehensive, Titanic-type pieces of legislation. If we can't agree, why not, on the big picture, why don't we take steps along the way? I think the American people would be a lot more supportive of that.
I believe that the latest round